beta hydroxybutyrate and acetone. All of these are acids. All of these are acids. So whenever there is ketosis, whenever there is increased amount of ketone bodies in the body, it will lead to metabolic acidosis. It will lead to metabolic acidosis. Whenever there is increased amount of ketone bodies in the body, it will lead to metabolic acidosis. To overcome this metabolic acidosis, plasma bicarbonates will act as a buffer. Plasma bicarbonate will act as a buffer to overcome the change in pH, to inhibit the change of pH by metabolic acidosis, which is caused by increased accumulation of ketone bodies. Plasma bicarbonates will start actioning. So as plasma bicarbonates start actioning, the amount of plasma bicarbonate will be decreased. So number one, metabolic acidosis. Number two, there will be less amount of plasma bicarbonates. Number third, there will be osmolar respiration. What is osmolar respiration? It is a hyperventilated state. It is a hyperventilated state when the respiratory rate is increased. Whenever the respiratory rate is increased, it is called osmolar respiration, to overcome the loss of this acid from the body. We know that acetone lost through the breath, acetone molecules lost through the breath, so there will be hyperventilation. Why hyper? The amount of respiration will be more. Whenever the amount of respiration will be more amount of acetone will be lost through the osmolar respiration. Number four, whenever there will be ketonuria, increased amount of ketone bodies in the urine, it will lead to dehydration. Whenever there is increased amount of loss of water from the body, different electrolytes will keep on losing with this loss of water, and these electrolytes are less amount of sodium will be present in the body. The sodium will be reduced and potassium will be reduced. So cation depletion. Number 6. There will be increased glucose in the body in the condition of diabetes mellitus or in starvation. There the glucose amount will be less, acetyl-CoA will be more. There will be metabolic acidosis, the respiratory rate will increase. There will be less amount of plasma bicarbonates. There will be cation depletion. There will be dehydration, and the last and the ultimate effect of this ketogenesis is coma. Coma is caused by all of these symptoms. All of these signs and symptoms will lead to the coma, state of coma in the body. The patient will be comatized. Why it will be comatized? Because there will be increased amount of accumulation of these acids, increased amount of acids in the body that will lead to metabolic acidosis. To overcome this metabolic acidosis, the plasma bicarbonates will come into action and start inhibiting the change of pH. There will be osmolar respiration. Osmolar respiration is a hyperventilated state. In a hyperventilated state, there will be loss of acetone breath will be there. Loss of ketone bodies, ketonuria. Whenever the ketone bodies will be losing, it will cause osmotic diuresis, and whenever there will be osmotic diuresis, it will lead to loss of sodium and potassium, cation depletion, and ultimately it will lead to state of coma. Now coming to treatment, let me tell you once again, if the amount of ketone bodies monitored in the body and they remain in normal states, it is not dangerous to the body. But whenever the amount of ketone bodies in the body keep on rising, more than it is being, more it is synthesized and less it is used, so it will lead to coma and all of these conditions. How to diagnose it? acetone breath through Rothra test. The test which is used is called Rothra's test to sense of acetone breath. Number second, electrolytes imbalance. The imbalance of the electrolytes. Number third, glucose monitoring. If the glucose is more or less, as in case of uncontrolled diabetes mellitus. Urea and creatinine levels in the body. So all, and the last one, presence of ketone bodies in urine. So all of these conditions will lead to the detection of the patient, the diagnosis of the patient with the ketonemia or ketonuria or ketosis. Now coming to the last and the final heading, that is treatment. Treatment is very easy. We know by now that ketone bodies are formed in two very important states of body. Either it will be starvation or it will be diabetes mellitus. So if it is diabetes mellitus, what you do, you give the patient insulin. When you give the patient insulin, oxaloacetate and acetyl-CoA will be formed, and this insulin molecule will decrease the amount of glucose in the body. Insulin will decrease amount of glucose, or it will supply this glucose for the energy. Whenever you give this insulin to the patient, what happened? The potassium keep on reducing. The potassium keep on reducing as well, because potassium is entrapped inside the cell. So whenever you give this insulin, please monitor this potassium level as well. In starvation, what happened in starvation? The amount of sugar was, the amount of glucose was less. So what you do? You give the patient glucose molecules. Whenever you give the glucose molecules, so glucose will be available for the energy and fat oxidations will be stopped. So glucose, whenever you give glucose, please remember that give insulin as well. So that this glucose, if it is administered, it should be remain in range so that it not keep on raising. So the treatment in diabetes, you give insulin. In starvation, you give insulin and glucose both spontaneously, and electrolyte balance should be there. The third one, that will be electrolyte balance. So this was all for the ketone bodies. We know that ketone bodies are of three types. We read about the formation of ketone bodies, the breakdown of ketone bodies, the conditions in which the ketone bodies are formed, why ketone bodies are there in the body, which give us energy. In starvation, up to 75% energy is supplied by the ketone bodies. Now we talk about the signs and symptoms of the patient. Besides the signs and symptoms, we discuss how to diagnose the patient and how to treat the patient with the ketone bodies. So this was the end of ketone bodies. Any question, most welcome to ask. Thank you.